There are many different ways of dealing with obstructive sleep apnea, but before we cover the medical ways of treating OSA, we must discuss the most common way those with sleep apnea in the US are handling it today. Did you know the most common situation those suffering from sleep apnea are in is going without any medical care for it? Research shows 26% of all US adults between the ages of 30 and 70 have sleep apnea today. And about 80% of these Americans with the condition have not even been diagnosed yet, meaning a vast majority of Americans are not receiving any medical treatment for their sleep apnea. So, whether by decision or not, we must discuss this non-treatment option as it is the most common. When one forgoes medical treatment for OSA, it can be said they are shortening their lifespan. This is because of the prolonged nighttime oxygen loss that sleep apnea imposes on the body. Studies show untreated OSA is estimated to reduce life expectancy 5 to 10 years due to the various health problems associated. This does not take into account the estimated 109,000 drowsy driving auto crashes each year, on average of which about 6,000 are fatal. So, it can be said that this first option of not treating sleep apnea is a silent killer. So, what are the ways to treat OSA? First, let's discuss the most commonly prescribed treatment, the CPAP. The CPAP machine is a device that pumps a continuous flow of air through a mask worn over the nose and/or mouth during sleep. This non-stop air pressure helps to keep the airway open, preventing the airway collapse that happens during sleep apnea episodes. It is considered a standard for OSA treatment, but because of the unnatural method of forced air, some patients find it difficult to get used to breathing with or against the forced air pressure, and some experience claustrophobia while trying to sleep with it. The discomforts associated with CPAP have led to about half of those prescribed it to not use it as they should or give up on it altogether. Now, let's talk about OSA surgery treatment options. We will discuss a couple of the most popular. The first is uvulopalatal or as it is more commonly known, UPPP surgery. This procedure involves removing excess tissue from the throat, including the removal of the uvula, tonsils, and soft palate. The goal of UPPP is to increase the size of the airway and reduce the chance of airway blockage during sleep. However, UPPP can have potential complications. The most common are prolonged pain and swelling in the throat and jaw for days or weeks after surgery, which can lead to difficulty swallowing or breathing. Another OSA surgery that is increasing in popularity is called hypoglossal nerve stimulation, or as it is more popularly known, the Inspire sleep apnea surgery. This newer type of surgery involves implanting a device in the upper chest. This implanted device sends an electric signal from the upper chest through the neck into the tongue that stimulates the hypoglossal nerve in the tongue. This nerve controls the muscles of the tongue and throat, so the electric stimulation shocks the tongue to move out of the airway during sleep. However, this unnatural solution to OSA comes with its share of risks, including the potential for the implanted device to malfunction or fail to work as intended, which can lead to unwanted nerve stimulation and in some cases the need for additional surgery. The implantation of the device may cause nerve damage, which can result in difficulty swallowing, speaking, or breathing. Other sleep apnea surgeries include maxillomandibular advancement, which involves breaking the upper and lower jaws to move them forward and enlarge the airway. Nasal surgery, which includes fixing structural abnormalities in the nasal passages. As with all surgery, each includes a risk of bleeding and infection. However, the worst risk of OSA surgery is the chance of the procedure failing to correct obstructive sleep apnea. These surgeries do not have great long-term success rates in treating OSA, as studies show that success rates for these surgeries as a whole range from as low as 16% to as high as 83%, depending on the surgery. In our previous video, we discussed that at Charlotte Sleep Solutions, we treat OSA with oral appliance therapy. Oral appliance therapy is not for everyone, but it does provide several advantages for those who choose it. The advantages to consider over CPAP are that oral appliance therapy most importantly allows for improved or higher compliance. What does this mean? Because oral appliances are often more comfortable and convenient than CPAP machines, patients on average use the oral appliance more consistently, which leads to higher treatment success. For CPAP intolerant patients, this means adding years to their life and a higher quality of life with more energy each day. What about the advantages of oral appliance treatment over surgery? First, and most importantly, starting with the oral appliance before surgery may save you from unnecessary surgical complications, some of which can end up being lifelong issues. Also, at Charlotte Sleep, we can now treat OSA with appliances that stimulate natural bone growth correction of the issue that causes airway obstruction in the first place. Meaning, some who use this special oral appliance treatment no longer need any device to treat obstructive sleep apnea once their airway is corrected through stem cell stimulated growth. We treat patients with oral appliance therapy because it is natural and is proven to have higher treatment success and patient happiness.